listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, dual eligible special needs plans. We've got the what, why, and how to get started selling these plans. The Beginner's Guide to D-SNPs, written by Roxanne Anderson. Whether you're new to D-SNPs or searching for information to fine-tune your selling techniques, this episode will cover all the basic information you need to know about these valuable, multifaceted products. Before we get into sales tips, let's go over what D-SNPs are. D-SNP stands for Dual Eligible Special Needs Plans. These are a type of Medicare Advantage special needs plan. Each state determines which D-SNPs a carrier can offer and the benefits they can include. Generally speaking, D-SNPs include the following: care coordination, $0 monthly premiums, over-the-counter quarterly benefits, dental, vision, and hearing benefits, transportation benefits, gym memberships, wellness programs, and telehealth services. Like other Medicare Advantage plans, there are different types of D-SNPs. 3 different criteria are used to categorize D-SNPs: their network, the Medicaid levels they serve, and their level of integration with Medicaid. We'll start with PPO versus HMO D-SNPs. When categorizing D-SNPs by network, there are 2 categories: Health Maintenance Organization, or HMO for short, and Preferred Provider Organization, or PPO. Most D-SNPs are HMOs. Looking closely at D-SNPs and their networks, HMO plans require beneficiaries to use in-network providers for all non-emergency services. They also require beneficiaries to elect a primary care physician and get referrals for specialists. HMOs are typically associated with lower out-of-pocket costs. HMO plans can be beneficial to those who qualify for the D-SNP, value lower out-of-pocket costs, are looking for plans with access to strong provider networks, and are okay with network restrictions. Next, let's talk about the PPO. This type of plan has a network of providers, but will cover beneficiaries for services received out of the network. Beneficiaries typically pay more for using out-of-network providers, but PPOs typically don't require the election of a primary care physician or referrals to see specialists. PPO plans can be beneficial to those who qualify for the D-SNP, value a flexible network, and are willing to spend a little more out of pocket if needed. In addition to PPOs and HMOs, there are 2 kinds of coverage with D-SNPs: full and partial. These different types of D-SNPs are based on Medicaid levels: full benefit dual eligible, or FBDE, Medicare zero cost sharing, dual eligible subset, and dual eligible subset Medicare zero cost sharing. Partial D-SNPs may accept individuals who fall into the following Medicaid categories: Medicare zero cost sharing, dual eligible subset, or dual eligible subset Medicare zero cost sharing. The type of enrollees they accept varies based on the plan. We'll go over the specifics of each D-SNP and their Medicaid levels, starting with the full benefit dual eligible special needs plan first. To enroll in this SNP, dual eligibles must qualify for full Medicaid benefits for the month under any eligibility category or medical assistance for any month if the individual was eligible for assistance in any part of the month. Individuals must be enrolled in or in the process of enrolling in a Medicaid Managed Care Organization, or MMCO for short. Medicaid eligibility categories include full benefit dual eligibles, qualified Medicare beneficiary plus, and specified low-income Medicare beneficiary plus, so FBDE, QIMBY plus, and SLIMBY plus. The next type of SNP, Medicare zero cost sharing. Dual eligibles who aren't responsible for cost sharing for Medicare Parts A or B can enroll in this type of plan. Medicaid eligibility categories include qualified Medicare beneficiary and qualified Medicare beneficiary plus. We shorten those to QIMBY and QIMBY plus. Our third D-SNP is the dual eligible subset. Enrollment is open to members of certain groups of dual eligibles determined by a carrier's coordination with a state Medicaid agency. Medicaid eligibility categories for the dual eligible subset include full benefit dual eligibles, qualified Medicare beneficiary, qualified Medicare beneficiary plus, specified low-income Medicare beneficiary, specified low-income Medicare beneficiary plus, qualifying individual, and qualifying disabled and working individuals. And then running down the list abbreviation style, enrollees qualifying under the FBDE, QIMBY, QIMBY plus, SLIMBY, SLIMBY plus, QI, and QDWI Medicaid categories can enroll in the dual eligible subset SNP. The fourth SNP on our list is the dual eligible subset Medicare zero cost sharing. Those eligible for enrollment are members of certain groups of dual eligibles, determined by a carrier's coordination with a state Medicaid agency who are not responsible for Medicare cost sharing. Enrollees qualifying for Medicaid in the FBDE, QIMBY, QIMBY plus, SLIMBY, SLIMBY plus, QI, and QDWI categories are eligible to enroll in the dual eligible subset Medicare zero cost sharing SNP. So, full benefit dual eligibles, qualified Medicare beneficiary, qualified Medicare beneficiary plus, specified low-income Medicare beneficiary, specified low-income Medicare beneficiary plus, qualifying individual, and qualifying disabled and working individuals. Also, important to mention here, effective January 1st, 2027, parent organizations that operate an affiliated Medicaid plan in a region may only offer one full benefit dual eligible special needs plan there. They may, however, offer additional SNPs for partial dual eligibles in that same area. Moving on, let's talk about integration levels, specifically the difference between integrated and non-integrated D-SNPs. Some D-SNPs coordinate with their state's Medicaid program to different extents. Fully integrated D-SNPs are the most integrated option available. These plans are affiliated with their state's Medicaid managed care organization through a single entity that holds both an MA contract with CMS and an MMCO with the applicable state. Highly integrated D-SNPs are affiliated with their state's MMC through the same MA organization, the MA organization's parent organization, or another entity that is owned and controlled by its parent organization. Another way to define the difference between integrated and non-integrated D-SNPs is to think of it this way. Integration facilitates aligned enrollment, where enrollees receive their Medicaid benefits through the D-SNP or affiliated MMCO. Non-integrated D-SNPs are not affiliated with their state's MMCO. Some D-SNPs feature exclusively aligned enrollment, only accepting enrollees who receive their Medicaid benefits through the D-SNP or their affiliated MMCO. Exclusively aligned D-SNPs may not enroll partial duals since these individuals are not enrolled in an MMCO. Now that we know D-SNPs have a few different levels of integration, let's go over them in more detail. First up,
The fully integrated, or FIDE SNPs. These are the most integrated D-SNPs, single plan entities with capitated contracts to provide both Medicare and Medicaid services. Medicaid contracts cover essentially all Medicaid services, including long-term services and supports, or LTSS for short. All fully integrated D-SNPs will be considered applicable integrated plans, or AIP, by plan year 2025. Here's an example. If ABC Health offers a FIDE SNP, that means the plan provides both Medicare and Medicaid services. Next on our list is the highly integrated, or HIDE SNPs. This type has Medicare and Medicaid contracts either directly or through separate entities under the same parent company. Medicaid contracts must cover provision of most Medicaid services, including LTSS or behavioral health, but plans are not required to cover both. Highly integrated D-SNPs may be considered an AIP. To give an example of HIDE SNPs from, say, XYZ Health, the XYZ Health HIDE SNP provides all Medicare services, while XYZ Health MMCO provides most Medicaid services. Moving on to coordination-only D-SNPs, co-D-SNPs for short. These are the least integrated D-SNP. Obligations to coordinate with Medicaid services are very generally defined, and a co-D-SNP must provide notice to the state when a member is admitted to a hospital or skilled nursing facility. For example, say that Yes Health co-D-SNP provides some care coordination with the 123 Health MMCO. The beneficiary would have a Yes Health card and a 123 Health MMCO card. Next, we mentioned applicable integrated plans, or AIPs. This D-SNP designation features exclusively aligned enrollment and can apply to FIDE SNPs, HIDE SNPs, or co-D-SNPs. This type of plan is only available to full benefit dual eligibles. Revisiting our previous examples, the ABC Health FIDE SNP for plan year 2025 would 100% be considered an AIP. As far as the XYZ Health HIDE SNP or the Yes Health co-D-SNP, both could potentially be considered applicable integrated plans. We talked a little bit about eligibility before getting into the different types of D-SNPs. Now, let's really dive into D-SNP qualifications. The short answer is dual eligibles, individuals of any age who are eligible for both Medicare and Medicaid qualify for D-SNPs. Now for a little more detail. To be eligible for Medicare, individuals must be 65 years old or older or have a qualifying disability. To be eligible for Medicaid, an individual's income and asset level must fall below certain thresholds determined by their state. The type of plan a dual eligible can enroll in depends upon the Medicaid category they fall under and the plans available in their service area. It's important to verify a client's Medicaid eligibility before enrolling him or her in a D-SNP. Many D-SNP carriers have agent support personnel who can assist you with this task. And some upcoming legislation to be mindful of. Effective 2027, the only individuals who can enroll in D-SNPs with an affiliated Medicaid plan will be full benefit dual eligibles enrolled in or who are in the process of enrolling in the D-SNP's affiliated Medicaid plan. D-SNPs with an affiliated Medicaid plan must disenroll any dual eligible individuals who are not also enrolled in the affiliated Medicaid plan by 2030. When it comes to default enrollment, an individual may be automatically enrolled into a D-SNP when they are on Medicaid and become newly eligible for Medicare, and the individual is in a Medicaid MMCO affiliated with the D-SNP. Individuals must receive notice of the upcoming enrollment at least 60 days before it will occur and have the opportunity to opt out. We've identified a lot of defining factors about the D-SNP: what it is, Medicaid eligibility, who can enroll. Now let's talk about when agents can sell D-SNPs. Similar to other Medicare Advantage plans, you can sell D-SNPs to someone in their initial coverage election period, the annual enrollment period, or the Medicare Advantage open enrollment period if they qualify. So during their ICEP, during AEP, or during the MA-OEP, as long as the individual qualifies. When someone becomes eligible for an integrated D-SNP, they qualify for a special enrollment period, or SEP, to join one. And as long as they maintain their eligibility for Medicare and Medicaid, they have an SEP to elect an integrated D-SNP once during each month. We'll go over some specifics of each enrollment opportunity, beginning with the ICEP. Individuals can make one change within the 3 months prior to enrolling in Medicare Parts A and B, and either the last day of the month before enrolled in Parts A and B, or the last day of the Part B initial enrollment period, whichever is later. The only exception is full benefit dually eligible individuals in an MMCO cannot select misaligned D-SNPs where applicable. How about during AEP? Dual eligibles can make one change between October 15th and December 7th, with the exception of full benefit dual eligibles in MMCOs who cannot select misaligned D-SNPs where applicable. Next, switching during the MA-OEP. Dual eligible individuals have one allowable change between January 1st and March 31st, and again, full benefit dually eligible individuals in an MMCO cannot select a misaligned D-SNP where applicable. Reviewing the SEP for electing a FIDE-SNP, HIDE-SNP, or AIP as eligible mid-year. Individuals who are full benefit dual eligibles can make one change per month only to facilitate aligned enrollment. And then beginning in contract year 2025, there is no longer an SEP for electing a non-integrated D-SNP as eligible mid-year. Now, you might be wondering, where can you find D-SNP prospects? D-SNP prospects are all around you, especially if you work near an urban or generally low-income area. If you sell near a large rural area, it will be more difficult to get prospects because CMS won't allow D-SNPs in counties that don't have a certain number of doctors. It will also be difficult to get clients if you do business near moderately to highly wealthy areas, since the type of prospects you're looking for wouldn't be able to afford living there. Since welfare programs and Social Security disperse payments near the beginning of the month, you should be able to attract D-SNP prospects in places where dual eligibles spend money during the first half of the month. During the second half of the month, you should be able to attract them at places where dual eligibles seek assistance. While you cannot scout potential clients, you can host a compliant Medicare educational or sales event, or leave compliant promotional materials where D-SNP prospects might go. These actions can help you stand out as a resource in your community for D-SNP prospects to come to you. During the first half of the month, try places like dollar stores, discount stores, thrift shops, and flea markets. During the second half of the month, you may find prospects at food pantries, food banks, and soup kitchens. Other good places to consider anytime throughout the month are utility assistance locations, community events like senior expos and health fairs, charity events, churches, or other faith-based organizations, areas with low-income housing, senior centers, or retirement communities. After you know where to go, it's time to focus on how to build your D-SNP business. You'll want to focus your efforts on two main objectives: utilizing grassroots marketing and providing superior customer service. Taking a grassroots marketing approach is the most effective way to get D-SNP leads and build your D-SNP client base. This type of marketing involves going out into the community where prospective clients are, engaging with them, as well as forming relationships with other professionals in the community who can refer prospective clients to you. Some strategies include volunteering at food banks, food pantries, soup kitchens, and charity events, visiting community centers, retirement communities, and areas with low-income housing, hanging tear-off flyers or business cards on bulletin boards at indoor flea markets, thrift stores, or churches, forming partnerships with churches, provider offices, nonprofit organizations, and retailers, setting up your own booth at community events, holding educational events, and sales events. Here's some great advice from one of our successful D-SNP agents. Quote, "Position yourself in the community as a resource, and people will come to you." End quote. And this is where it's important for me to note, you must follow all CMS, Medicare Advantage, and Part D communication requirements for marketing these plans and holding events. For more information on how to stay compliant, check out the links in our episode notes. Another way to make yourself stand out in the industry is by providing superior customer service. Treating people right will increase your chances of converting prospects into clients, getting referrals from existing clients or professionals within your community, and retaining clients. You can provide superior customer service by becoming well-informed on the subjects you hear prospects and clients asking questions about, educating your prospects and clients on their health insurance programs and options, making sure your clients understand their plans and benefits and how to access their care, letting your prospects or clients know about other people or programs that can help them with their non-health insurance related needs when appropriate. Now, you might be wondering about how to retain D-SNP clients, and that is fair given the nature of D-SNP enrollment. The fact that dual eligibles may be able to join or switch D-SNPs mid-year can be a double-edged sword. On one hand, it gives you the opportunity to find new Medicare Advantage clients anytime throughout the year. On the other, it gives other agents the opportunity to simultaneously swoop in and steal your clients. In order to avoid losing your D-SNP clients, ensure you establish trust with them. Be someone they know they can come to with health insurance questions. Provide them with superior customer service. Do everything you can to help them while maintaining a professional relationship. Remember to communicate effectively, both in person and digitally. Confirm they'll know how they can best reach you when they have a question. Give them your phone number and email address. Here is a pro tip and one of my favorite tchotchkes. Fridge magnets are harder to lose than a business card. Follow up with them within the first 30 and 90 days, and then every 6 months to 1 year. Check how they're doing, if their income or prescription drug needs have changed, and if they've used the extra benefits like dental, vision, or over-the-counter. Taking these measures can help you build client loyalty. Don't forget, the smallest of actions can make a huge difference in the lives and minds of others. And before we wrap it up on D-SNPs, it's important to remember the why behind selling D-SNPs. You've learned that selling D-SNPs can earn commissions during Medicare's off-season, but there's one point we do need to make clear. If you're only interested in selling these products for your own profit, you may quickly find that you're not working in the right market. The dual-eligible population can be difficult to work with. Out in the field, You'll encounter many people confused by their health insurance options. Your ability to explain things in an easy-to-understand manner and effectively answer questions will be tested. You may even find yourself in houses that make you feel uncomfortable. Simply put, agents who sell D-SNPs do so because they truly want to help others through their business. You should sell them if you want to do the same. Contracting with D-SNPs can open the door to many new opportunities for your insurance business. To learn more about these products or to find out which ones are most competitive near you, reach out to us at asgpodcast@ritterim.com or by leaving a voicemail at 717-562-7211. Thank you for listening, and we will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Roxanne Anderson. Script adaptation by Tina Lamoureux. Recording and production by me, Sarah Ruppel. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Follow along with our show wherever you like to listen.